effect. And we're seeing there is much more of a need to connect, to check in about our mental health. The stress, the anxiety, the worry, the adapting to the new isolation, the new normal has been really, really challenging for every single one of us. It's even more important that we're staying socially connected to each other, because that is the hallmark of positive mental health, to see each other's faces, to hear each other's voices, and to express the warmth and care for each other is really what people need and what they're looking for. So at CMHA, we have 450 staff, and we have staff across Waterloo region, so Kitchener-Waterloo, Cambridge, Guelph, and then we support rural Wellington as well. And it's not just support, we've continued treatment as well. Many of you know in the community, we have an amazing centralized access and coordinated mechanism called Here 24/7, where anybody across Waterloo and Guelph and Wellington can call and receive a very streamlined approach to what's available in our mental health and addictions world. And then we match people to the services that are appropriate. Tremendous concern for our frontline healthcare workers. That's why we really mobilized Here for Healthcare so very quickly. They're all faced with an incredible amount of stress. They're putting themselves at risk so that they can take care of our community. So we feel that this investment in our healthcare system is critical for keeping our healthcare system going right now.
We actually mobilized really quickly. So still have a whole caseload of patients that I'm seeing, and I do that either via phone or I do that via PCVC, so personal computer video conferencing. I'm still providing medical support as well as therapeutic support for many of our patients in this clinic. Some of my patients have a lot of social anxiety, so they're finding that being isolated at home is great. They don't have to deal with the anxiety that they experience by going to classes, by doing presentations, except that I recognize that they still need to be able to move forward in their lives once this is all over with. And I will see people face to face if it's medically warranted, for sure. But what I find is that most people just need a check-in. It's the other thing that I've been finding is really neat is having a lens into people's lives. People that I have been working with for a while, you know, they're showing their resiliency around things. So they're showing me things that they're doing when they're at home. This is so cool because I wouldn't normally see that in the office. So, you know, one of my kids showed me her pet cat, right? She introduced me to her cat, and not something that she would normally do in the office. And that's what she's been using maybe to self-soothe herself through lots of things that are going on. Or the crafts that somebody's doing. Somebody's doing some crocheting to distract themselves. They're showing me that. It's very, very neat to have that lens. I mean, I often recognize with many of the patients that I've been helping is that this is an opportunity for them to recharge. It's kind of an opportunity for them to connect with others in a little bit differently, maybe socially or otherwise, things that were barriers for them in their day-to-day life, allowing some time for physical and mental rest for some individuals, which they wouldn't normally get because of the pace of their lives. So there's huge value to that kind of pause and reset. There's an awful lot of fear that people are experiencing, but with that fear, what I have seen is courage and bravery to try things a little differently, to work through things differently than maybe what they would normally do. That courage has been really amazing for me to see for people that have struggled with a lot of mental health issues. Am astounded and feel so privileged to work with people that have such resiliency and, you know, are wanting to continue to meet, even if it's in a very different format for what they're used to. That kind of courage I find absolutely astounding. It makes me feel really good to be able to do what I do.
So if we can monitor our own behavior and our own anxiety level, we're going to be doing a lot of favors for our kids, because our kids, because they take their cues from us and because they are generally pretty resilient, they're going to know that that things are going to get better, that we don't know when that's going to be, but that the adults around them will be able to keep them safe. I don't want to downplay how the challenges that our families have experienced with trying to figure out how to parent, how to work if they can work, how to manage financial stress if they can't work, how to try to be teachers for our kids as well. None of this stuff has been easy at all. For parents, if they can take the time to talk with their kids about the challenges, about the changes that are going on. So if we ask our kids, what do you know? What is it that you understand? What is it that you, and then if we can help them to recognize that life is about change, and that change happens all the time. And sometimes change is good, and sometimes change is not so much fun. That change is something that we all go through, and that we can actually find ways of being able to manage this and maybe even get something positive out of it, then they're going to come through this. Our kids, especially our particularly anxious kids, are going to be feeling the anxiety of the world right now. There's just no question about that. But if we can, as parents, really help to model that big emotions come and they go, that we can manage them, that we can keep ourselves safe, then they themselves are going to end up coming out of this actually even more resilient than they were going into it. And really, another thing that we can think about from this is we can consider this somewhat of a reset. We can come out of this thinking and teaching our kids that we can actually think about, what do we want to do differently now? Another thing that this does is it can really help our kids to recognize the value of community by turning our energy outwards and looking at, yes, we need to do a lot of our own self-care, but what does our community need from us now as well? I talk about the media and monitoring how much it is that we consume. Again, if we are only consuming the global picture and we are only ever talking in those great big numbers, then we do miss the wonderful work that is being done immediately in our neighborhoods. What do we need to think about, and what can we control right now? And that will really help kids to gain a much more, a perspective that feels much more in their control.